Whoa,
Yay, there we go.
I think we are there.
Yay.
All right, let me try now. Again,
I got my
Facebook.
glasses too.
Facebook making me crazy. Where are we? Okay, I'm still not seeing us on our phone, but we are on the VBF page, people. So, okay, let me get out and back in. And there we are. Yeehaw. Oh. Okay, everybody. It's Dr. Linda, the VBF. Much apologies. Again, technology. So welcome to our VBF Month of Awareness. Oops, sorry.
Ooh.
Got out of there. Oh, nope. Where did I go? All right. My hands are making me crazy. No viewers yet. All right, well, log on and tell us that you see us. Well, here it says 2. Okay, so let us know if you see us. Kiana, whoever. We're here. We're live in New York. Welcome, Paige.
Thank you.
For our month of awareness. We got a little bit of a rough start because, I see people jumping on. We got a little bit of a rough start because of, once again, technology. So if you are on, if you see Paige and I'm Dr. Linda, the president and founder of the VBF. And Paige, go ahead and introduce yourself.
I'm Paige. I'm with 𝗧cie𝗽𝗶𝗰.
And?
Oh, and I'm birthmark advocate, film producer, model, about to be actress.
VBF influencer.
VBF influencer.
Oh, about to be actress. I like that.
Yes.
I see that Kiana. Hello, Kiana. I'm glad you can see us. We had a little bit of a rough start. So we are on today to talk about birthmarks, advocacy, awareness, any medical questions you might have, anything. As I see more and more people are joining, tell us where you are from, tell us your name, say hello. I like to hear all the places that people are live from. Most of the time it's not even here, most of the time it's the other part of the world. So let us know. It says there's 6 people on, so let us know who you are, say hello, tell us your name and where you're from, and let's talk about awareness.
Yes.
Before we start getting some questions. And I know, Kiana, you said you're on. I'm not seeing that comment, but, oh yes, I see Deb Peters is watching. Hi, Deb, it's good to see you. Let us know where you're from. And let me just say hello, just I want to see that the comment shows up. Because we're having, okay, yeah, so it's there. Good, so I can see that now. Hi, Priscilla. Priscilla's on from Amsterdam. Great to see you. Thank you, Priscilla, for joining us. So anyways, Month of Awareness. The reason I started it back in 2004 was because there was no month of awareness for all birthmark types. There was always something for Sturge Weber because they've been around the longest. But VBF is like the generalist over the 9 primary birthmark types. Hello from Georgia, Alexander. Hello. Hi, everybody. Yeah, you're from down that way, right? You're from Louisiana?
I have family in Louisiana. But we don't really talk.
Hi, Amy. Hello, everybody. So I started the Month of Awareness in 2004 so that we could collectively have a voice to move towards an accurate diagnosis and appropriate treatment, because back then there was an 85% misdiagnosis rate, which meant people with a port wine were called a hemangioma, probably you were, and people with a hemangioma might have been called a port wine, and then they'd get the wrong treatment. Right. Today, that misdiagnosis rate is 65%, which is unacceptable. Yeah. And that is what awareness is about. The more awareness, we hope to lower the misdiagnosis rate, because every child is entitled, an adult, to having an accurate diagnosis so they know the treatment plan. Hi, Amy. It's good to see you. And hi, everybody. So people are starting to join. And again, the purpose of our Month of Awareness Facebook Live, and we will have another one next month with Dr. 𝗧cie𝗽𝗶𝗰 that's more medical, that we normally do, is to talk about, so why? We need awareness so that you can get an accurate diagnosis, appropriate treatment. But more important is awareness is what brings access to care. Yeah. We all know somebody famous gets something, then all of a sudden the whole world is aware of, oh, that rare condition, and then all of a sudden there's money and there's research.
Right.
We don't have like a super celebrity or somebody like that in our pocket that works with us to bring that kind of awareness. I wish we did. We know people like Drew Brees has a birthmark, and Tina Turner had a port wine on her arm, and the guy from the Smashing Pumpkins,
Billy Corgan.
Yep, and Ed Sheeran has a port wine by his eye, Drew Brees. So we do know that there are people, but I've tried.
Right.
I've tried.
Right.
So I see Live Not is on. Let us know where you're from, Monica. Let us know where you're from, everybody. Chelsea, hi Chelsea. So two things. We're here to talk about awareness. We're here for Paige to talk about her industry and what she's doing to bring awareness and inclusivity, right, to our community. I'm here for answering any medical questions that you may have. Hi, Catherine. Hi, everybody. Hi, Kathy Hodgson. How are you, Monica? So thank you all for joining us. Again, any questions medical related, I can answer. And of course, if you have any questions for Paige. So as you know, she is also a model. And being a model and having a birthmark, did that hinder you or help you?
It's a really good question. Both. I think in the beginning, it very much felt more of a hindrance and just in everyday life, you know. So my beginning modeling career, amateur career, I covered it up, which started probably like in high school when I really wanted to kind of take something like that seriously. And then it wasn't until my, early to mid 20s when I started the Instagram where I actually for the first time took a photo with the birthmark as the focus and kind of the highlight and in a more proud, presence and demeanor. So when I started highlighting it, and that kind of unlocked a new level of acceptance and embracement that I didn't know that I needed, and I didn't know that I needed permission to be able to do. And then it became not a hindrance, and it became my calling card.
Right, like your signature.
Now it's my absolute signature, and now I have an agent. I wasn't able to get an agent when I was covering up my birthmark, but showing up to auditions with my birthmark. So they were very confused, understandably a little bit. But yeah, now I'm getting calls specifically for having a uniqueness. Yeah.
Inclusivity, something that we have to always make sure that we protect. Right? Because especially in current times and the future and who knows, everybody has a right. We're all equal and fair, and where I stand as the mother of a child with a vascular birthmark, the day I was getting ready to take her to have her hemangioma removed, someone said to me, did you do that to her? In other words, did I hurt my child and cause this? And that's one of the reasons I created this card, that it's a vascular birthmark card, is because moms were being accused of child abuse.
Right, my mom too.
Yeah, your mom, there you go. And I just posted about a case that Dr. Cohen and I worked on where a nurse had her baby taken away from her with a birthmark, and she lost her license temporarily because they thought she abused the baby, and she was from the UK, and we provided the documentation for the barrister to dismiss the case.
I hope she got
it. I know, she got the baby and her license back, but she was just grateful for that.
Right.
But that just shows you the stigma that is so prevalent. Hi Sharon, hi Catherine, hi Mylin, hi Amberlyn. A lot of people are on now. I'm not seeing any questions, but you're more than welcome to ask them to. Hi GD, hi anybody with any medical questions or questions for Paige as we sit here and talk about, even as you talk.
Comments about like what they're doing for Month of Awareness.
Right. What are you doing for awareness? Hello from Seattle, Monica.
Oh,
hello.
That's where I'm from.
Yeah, hello Seattle.
Hello, Monica.
So, in Kenya.
Yeah,
Kenya,
cool.
right? Yeah, very cool. Lack of access.
Oh man, yeah.
Africa's only got one place, and that's in
Right.
South Africa that treats vascular birthmarks, and it's just grueling. Like every day I get emails, can you give us money so we
Right.
can get treatment? We only have 2 full-time employees, but I'd rather fight the laws and make the laws change to provide the insurance for people to get coverage
Right.
because they should,
That'll get more broad.
because it's a congenital birth defect, so
Yeah.
it should be covered. And it's rare, so it should be covered.
Yeah.
So hi, Amberlyn. Chelsea, my son has a port wine on about 90% of his body.
Oh, how cool.
Yeah, and I'm not sure if you've been
That's
through the VBF network or what you're interested in, but I hope you have a good team, because when it's that extensive, you know, we need to have some workups done. I don't know if you've been in communication with me or not, Chelsea. If not, you can always PM me at Linda Roselle Shannon or through VBF if you have any questions. Oh, we got somebody from Kuwait.
Wow.
Well, I know we get them
Wow.
a lot. Where are you from, Irina? You got to let us know. And 𝗧cie𝗽𝗶𝗰, where are you from? Let us know so we know. And we're here to talk about awareness, why we need it, because there's a lack of it. There's a lack of what these are. There's a lack of access to care. There's a lack of insurance covering treatment. And there's
And that's just the tip of the iceberg.
that's the tip of the iceberg because
It doesn't even talk about representation,
right.
or
That's exactly what I was going to get into is how do you educate people when you're just walking down the street and somebody walks up to you and says something really rude,
Yeah.
and maybe they didn't wake up that morning and say I'm going to be a jerk and say something really rude to some human with a birthmark on them, but then they just walk up and say something really rude,
Yeah.
and you it's got to take your breath away at times. Like, have people walked up to you and said something?
Oh yeah, all the time. It really depends on the mood, you know. It's like,
Yeah.
but most of the time, you know, I try to be as open as possible because I do love to educate. But unfortunately, that's not always how I'm approached. It doesn't always feel like people are wanting to learn. And so, yeah, you know, I might not be as open to wanting to be. Like, I can be spicy. We gotta get spicy in life, you know?
Yeah.
And it's like, if they're gonna be invading my space and be spicy, I'm then educate that boundaries are a thing. So I guess I'm still educating one way or another.
Hey, I am all for a new tagline, spicy birthmark.
Oh,
birthmark.
yeah.
Come on.
Yeah, don't bring out the
The
spice.
bedazzling and,
Yeah.
and the glitter and the things you do are just so wonderful. And maybe this, you know, as I've told you before, I had a survey of 840 some adults with port wine stains, and 30% loved it, 30% hated, and 40% were neutral. And that's okay. Everybody's entitled to have their own family or feelings about their birthmark, and we don't discredit anyone. People have complications, they have glaucoma and so many problems, and there's nothing to love about that. But what we can do is make them feel a part of a community. What we can do is offer them our support, offer them, if they want information on what is the proper treatment, what is the proper diagnosis, we're always there to give them that. And to also help them lobby in their own community
Right.
to have more awareness, acceptance, tolerance, and access to care. Because it's equal. Equally, you deserve proper access to care. Equally, you deserve acceptance.
Totally. Yeah.
Correct?
Yeah, access and
So
opportunity.
many more people checking in from DC,
Morocco.
Pennsylvania, Morocco. Yeah, see?
Yeah, spicy beef.
Tiana likes that. Spicy bee. Hey, Tiana, you
That's
came up with
funny.
that. And I think we're using it. So you better put that in the back of your hat. Spicy bee
Yeah,
time.
spicy
So
bee
spicy
time.
bee time is
Yeah.
going to be fun time with birthmarks.
Oh yeah,
I
and there's
love it.
New York. New York
Yes.
has just introduced itself.
Yep, the honking of the horns. We may hear a police car.
Yeah.
Oh, yeah, an ambulance or
Cue it.
something. Yep.
And action.
Right, exactly.
Oh, I love that response. My response is, you should see the other guy. Yeah, I mean, yeah, that's a good one. That's always and it kind of always takes them off guard a little bit. Like, oh, I shouldn't mess with you for a second. But yeah, I mean, like, love to, you know, to say, hey, it's a birthmark, but I will also remind people definitely that, like, hey, how you approached was inappropriate. You know, if you really wanted to learn, blah, blah, blah. Because it's, you know, a lot of people, I think, they sometimes just don't think. That's really what it is at the end of the day.
Yeah, I
You know,
don't think that's-
wherever the
yeah.
intention is, it's just, there's
Right.
not a let me think about my reaction. They're just reacting. So sometimes I think subconsciously they come across not very kind or kind of invasive, but they don't intend to be.
That's
so
what
sometimes
I
I need to learn about just boundaries
Education,
and like,
mhm.
hey, next time if you see someone with a difference, this is maybe a better way to ask and approach. And sometimes the people are like, oh wow, like, you know, actually I didn't mean it like that, and thank you for letting me know. Other times
That's why I'm a big advocate for my book, Birthmarks Are Like Flowers, to be in every preschool and kindergarten, because it teaches kids that just like flowers are different, kids are different, and they can have, and we've got vitiligo, blue rubber blood nevus, we've got port wine hemangiomas, we've got all the birthmark types. And if kids can learn that kids have differences in pre-K and kindergarten, and that they're just like flowers, which are different, then maybe we can have a more tolerant society. Wonderful note to you from Priscilla. Paige, thank you for pioneering the way for port wine. I saw your face in the ad at Sephora. I'm in my 60s now, but when I was about Paige's age, I dreamed that I was asked to be in a fashion show without makeup because of my birthmark, and the scouts were telling me that skin that was colorful was going to be the new thing. I did start to see the models with vitiligo. Glad to see port wine stain in the mix. I have to say, it took my breath away seeing you in Sephora. And then my daughter was like, hey mom, that's Paige, you know, like, I know. Worldwide, right?
I know that internationally I've seen people send me photos from France and Amsterdam, but I don't know about other places.
Well, they gotta
outside
send
the
them
US,
to you. And what's your email so people can get in touch with you?
It's also in my bio and on my Instagram, but it's info@flawlesseffect.com.
Good. It's okay. I mean, Kian, if you can put that in there, info@flawlesseffects.com.
That's so sweet. Thank you so much, Priscilla.
Yeah,
it's really cool.
Melanie says, people always ask, what's with his foot? He has a large congenital hemangioma. My son is 16 months. I don't want him growing up thinking something is wrong with him. Cincinnati Children's is talking about removing it at some point, but for now it's important he builds confidence. Absolutely. And if it is congenital, just so you know, unless it's a reach, which rapidly involutes on its own, it does have to be removed. So the sooner the better for him, because if it's on his foot, you don't want any pressure for him beginning to crawl, walk, or stand and hold himself up. So bravo to you, Mama Melanie, for getting the ball started at Cincinnati Children's, and they do have a good vascular anomalies program. So
or at least just wanting him to build the confidence as well in the meantime. You could always look at it. I mean, I look at mine as a superpower, and it's really helped kind of shape it as just a fun accessory of life, really. And it's it's to have an approach of being different as a good positive thing, kind of like what Linda was talking about with flowers. It's like we look at flowers being different or like missing a petal, and we just see that as nature. We just see that like, oh, how cool. We don't look at it and go, what a flawed flower that needs to be fixed. Usually the more rare flowers are the more sought after. And just looking at it that way of just how beautiful of an array of art that nature has, I think, we're all things would be cured, and hunger would be done. Cancer would be cured, all of it.
When you first read the book, I remember you saying your favorite flower was in it, and which one was that?
I think that was the stinking lily rose.
Because I have really unique flowers in here, like the ghost orchard, and I tried to do
the monkey orchard too. That one's so cute. Which I just learned about recently. So when you put that in there, I was like, how cute.
But I'll tell you something that's very important for parents, and you have to stick to it because you cannot give mixed message to your child. So if you keep saying God blessed you with this is from the angels, and then you're dragging them kicking and screaming the laser treatments, that's a mixed message.
Right.
Because the kids are all telling me, why did they say this was from God, and then they're making it come off of me.
Right.
So I think parents really have to be careful, and the best language is, it's a vascular birthmark. Exactly what it is. You got blonde hair, you got blue eyes, and you got a vascular birthmark. Just normalize it.
Right.
Blonde hair, blue eyes, freckles, you wear glasses, and you have a birthmark.
Well, a lot of the doctors that growing up, they never really approached with myself or my mom of, oh, there's just a maintenance and a health aspect that we need to approach and talk about. It was always, lasers were always talked about in New York. I don't know, this will be too loud. I don't know if you guys can hear me. They always kind of approached it in more of it needs to be fixed. So like the lasers are going to lighten it. It wasn't until later in life that I learned that this is progressive and I actually need a laser or X amount of lasers specific for the texture, specific for the thickness. I didn't know about that later in life. That's why I was so my relationship with lasers was very different growing up because I didn't have the knowledge. And I think even as a young child, I would have absolutely understood, hey, like, this is what you need to keep your skin healthy. It's not anything to be fixed. And this is how we can do that. And now that's exactly how I approach lasers. And
great question for you. How do you deal with job interviews or maybe a modeling interview or whatever?
So when I'm not being a birthmark advocate, I am a film producer and I work on commercials and feature films. And that working behind the scenes, I always get jobs with kind of just people will hire me that know me and or have been referred by me. So the discrimination with some of my work I've been very lucky. My first job though with Hollister, I do remember coming in one day without my birthmark covered up. I was still covering up my birthmark in high school, and I did not get to work the register that day. I got to work the back room folding the clothes. So now it's when I go into something new, modeling or meeting new people in a different aspect that's not film production. This is highlighted a little bit. I put a little blush on it. I'm not trying to hide it. There's no mention of it either. Obviously it's a big part of my identity, but I'm coming in knowing that my skills are what we are there to talk about. And I have a more unique aspect that if it was client facing and they were worried about, oh, you're going to make people uncomfortable. No, I'm actually going to make your customers remember me and the product that I'm selling because they have never seen anybody like me before. So it's going in with that confidence of knowing that you've already have the job and that they would be so incredibly lucky to have you. And what a moment that you're gracing your time and your energy to these people. And if they're not going to see that, then they are absolutely not the right fit. But there are people out there that are going to see completely past your facial difference, if you have a facial birthmark or something like that, or visible difference, I should say, because your confidence will be the one that's leading the interview, not your difference.
I love that, and I want everyone to know that I coined the phrase, you laser to keep the skin healthy. And I'm so proud to see so many people using that language now.
Right.
This isn't about making it go away or making you look perfect. It's about keeping the skin healthy because by the third decade, 70% will thicken and develop blebs. And
I see it.
You're in the third decade and you're seeing it in
not necessarily in myself, but because I've had a good amount of lasers growing up. But the older generations, the older friends that barely had any treatment done. Yeah.
Right. So it is important to remember that it's to keep the skin healthy, and that's what that vernacular is about. And I love what you had to say about even with the face-to-face and just having this confidence to change the whole dialogue, and that's what awareness is about, is changing the dialogue from what's wrong with your child or what happened to your child or what did you do to your child. All three were said to me. All three things were said to me. What did you do to your child? What happened to your child?
How did you let this happen?
Yeah, how did you do? Even by my own family, when my daughter had this big hemangioma, they're like, oh, was it your age? Were you dieting too much? Like everybody's always ready to blame the mom, blame the mom. Which is why VBF does what it does. We don't just give out the medical information. The psychosocial, the awareness, what Paige brings is equally as important as the accurate diagnosis and appropriate treatment. Because the biopsychosocial model of disease is biological and psychosocial together. And thankfully, medicine is reinstating that into medicine, where they're not just treating the person, they're treating the psychosocial component. Because so many patients told me, 30 years ago, 20 years ago, they get laser and never even have a conversation with the doctor. Never had a discussion that this could thicken, or this could be this, or this could be that. So awareness is also about educating doctors, and is getting, like Paige does, she's bringing awareness to the entire world with the Sephora ad. When anybody that goes in there, and there's a lot of dudes that go in there, whether they're with their girlfriend or themselves.
Right.
You're not just getting women.
Yeah.
You're getting...
Oh, I did have a guy friend, and he was like, my wife put me on an errand run to Sephora to get cosmetics, and he was like, who did I see?
See? I love that.
Yeah.
I love that.
Yeah, it's fun.
She says, I hate when people say, what caused that? It makes me feel like I did something wrong. True.
Yeah.
The one good thing about PWS, port wine and 𝗧cie𝗶𝗰, is we know it's the GNAQ mutation. The only one we haven't found the mutation for is the infantile hemangioma, but all the others are genetic, so you can blame it on genetics.
We can officially blame it on genetics now?
Yeah.
Oh, wow.
Because the port wine stain is a somatic mutation of the GNAQ gene.
So is that why the same family members might have
They
one?
can, but usually when it's multiples in a family, we have to look at the CMAVM, which has more mutations, like mutations over mutations, because it's got the port wine, GNAQ, and then the TIE2, which is the AVM, so it has one mutation over another. And everybody's going genetics crazy now. I prefer they focus on getting an appropriate treatment plan and access to what they need, but let them keep doing the genetics, it's fine.
Interesting. 'Cause my grandma has a red pink one on her knee. It's either a port wine or
Well, if she
strawberry.
let her press it, and if it blanches, it's a port wine, it's capillary. If it doesn't blanch, it's probably a congenital hemangioma that will be there the rest of her life. That's very interesting. I said that so the congenital ones, Melanie, each one is different. There's a 𝗧cie, a niche, and a 𝗧cie. Rapidly involuting, partially involuting, and non-involuting congenital hemangiomas. And the mutations for those have been reversed, and going forward, the more they study the tissue samples. So right now, they're not labeling them other than saying that they're a fully present at birth mutation. That's it. Which would mean it's likely somatic, because if you can pick it up on ultrasound, then usually it's somatic. And many of these have been seen, many of them are seen, the congenital lesions usually are.
That makes sense, okay.
𝗧cie𝗽𝗶𝗰 said, thanks for replying, Miss Paige, and thanks to Miss Linda. I'm 23, and next year I will start treatment. I have port wine in my full right cheek and 1/3 of my mustache. Just remember, 𝗧cie𝗽𝗶𝗰, not that, I'm just letting you know, maybe you'll be glad or bad. Anyone knows that any laser in this area can result in permanent alopecia, or lasering around, if you have a birthmark around the eyebrows. It's not everyone. Some have like a relative alopecia where it does start to come back. But most of the doctors have avoided the hair bearing, except for the guys that have the port wine in this area, and a lot grow their beard, knowing that if they do get the laser, they can't grow the beard.
Interesting.
So,
well, my mustache keeps coming back, so I don't know what's happening there.
oops. So, anyways, okay, so Anka, hi Anka, she's 40, I've never had laser and my skin didn't get thick, thank God. I noticed that if I don't drink coffee or eat dark chocolate, sleep regularly, and work out, it looks pink.
That's
well,
fun.
I'm not giving up my dark chocolate.
Yeah, I don't know what my blood flow's doing. It's
that
fine.
would be too hard for me, but those are all good things.
How
because,
interesting.
Well,
does that affect blood flow?
Yeah, what she's doing is, so caffeine is a vasodilatator, dark chocolate, all of that is, so opens your blood vessels up more.
Interesting.
Non-involuting. So he has a niche. Yeah, that absolutely has to be removed. So Barbara, hi, I'm pleased that our birthmarks are being acknowledged at at age 81.
Yeah.
Woo,
Oh,
yay.
boy, yeah.
It was not acknowledged when I was growing up, teased by some. I worked in healthcare and would wear long sleeves, but many felt I was contagious. My birthmark on my neck, right arm, shoulder, and chest, prom dresses, and lots of makeup, but it still showed, not just as bright. Worried my children would have it, and your daughter is hydrocephalic. Well, there are port wine stains that have that hydrocephalia, and that is a separate syndrome. But I don't know that there's a connection between having a child with one when you've had a port wine. That I've never heard of. So I don't.
What's hydrocephalia?
Oh, enlargement.
Oh, okay.
Hydro with water on the hip.
Oh, okay.
So, wow, we have a lot of you on, and
I love to learn.
yeah, and I want to make sure. So she was saying he's the only one in the family that we know of that has anything like it. There's still so much research to be done on these lesions.
Yeah.
So I want to make sure I didn't miss any. Priscilla, thank you
Is
for
a
making.
port wine considered a lesion? No, right?
Well, so
Is it very?
the terms are always changed around because people who have lymphatic malformations, they can have a cutaneous port wine on the outside, but they don't like it called the birthmark because it's not flat.
Okay.
So they're called like a vascular anomaly.
Okay.
I will use the word lesion. A lesion means something on the skin. That's all it means. It's something on the skin. I use that word lesion a lot because it's just the lowest level word for referring to anything on the skin.
Okay.
So it's
Makes
like,
sense.
yeah, it's, again, there's a lot of people that have venous malformations and they don't want it called the birthmark. But Mulligan wrote the book, Vascular Birthmarks and Hemangiomas, and put them all in that category initially. So it's all new relearning.
Okay.
Let me see, there was some more that came in. That was,
Hi, Brianne.
Alessandra, my daughter is 10 years old, was so happy to see your poster, the makeup brand at the makeup store. She took a picture with your poster.
Send it to
love
me,
that.
please.
Yes.
Yeah, DM. I mean, I'm more active on Instagram, but yeah, send.
What's your Instagram?
It's flawless. Oh my god, at flawless _ effect with an AFFECT.
If you can snag that, Kiana, and post that there so people can follow her or reach out to her. Thank you for that. So Melanie's saying at first they didn't want to remove it. If they end up not wanting to do the surgery, I have a million people that can do it for you easily. So just send me a private message in Messenger, Melanie, and let me see a picture of it now. But if you want it removed now, I know I could get somebody, because the 𝗧cie, which is the International Society for the Study of Vascular Anomalies standards, is for niches to have surgery done before the child is 2 years old. So to have it removed. So I can definitely, recommend someone for you for that, or at least give you 2 or 3 extra opinions from experts. Hi, Cambria. Haven't seen you in a while. Love to catch you live. You've been such a blessing to my grandson. Banksy's my buddy, and his mama. Tyler and the Bonowitzes.
I think so. Yeah.
Yeah, Banksy is the little boy, and he's into wrestling now. And, and Hamster, I call him Hamster, his brother. But yeah, Madison and Taylor. So thank you for that. Cambria's lucky she has those 2 grandsons. I don't have any grandkids, so I'll have to adopt them. So Jeff says, I'm 56 years old with a facial port wine. Glad to see people aware of the glaucoma implications. Yes, and by the way, I'm working on a project with Dr. Comey, the leading Sturge-Weber expert in the world, and no one's done this, but starting at our clinic in New York, we're doing glaucoma screenings.
I heard, yes. I'm so
And
excited.
this is so important for the babies to be identified before they have to start doing the drops, so there's no vision loss. Because with glaucoma, the more you delay starting the beta blocker drops to control the glaucoma, the more vision loss you can have. So we are starting this new at birth. If it's in the zone, of a 𝗧cije_𝗶𝗰 glaucoma to get the checkups, and don't, just because it's clear doesn't mean you stop. You have to keep looking into it because it can come out at any time.
Yeah, like I just started feeling pressure a few years ago, and then I saw two different doctors that gave me two completely different diagnoses. First one was like, oh yeah, you already have scar tissue, there's pressure happening, let's get you on eye drops. The other one said, he was like, oh no, you're completely fine, you're totally, and he kind of acted as if I was crazy. So I'm very excited to be testing with VBF.
Do you know what they said your pressure was in your eye? Did you get a number?
I did. It's somewhere at home. I mean, the last test, or the second guy I saw who said, oh, you're totally fine, I think it was at 19.2. So
right,
I was like, so just under 20. Yes. Yeah. But yeah, he.
But the other
like
one, well,
crazy.
because it can fluctuate.
Right.
Now, another important thing about glaucoma is, if you are having yourself or your child lasered and they put the eye shield in,
yep,
you cannot get your glaucoma reading for 24 hours because the pressure from the eye shield on the globe raises it.
Yeah.
And it'll be a false high, and you don't want that. Thank you, Kiana. You're right on top of things with providing emails and Instagrams. Hi, Kay. Was really sorry you couldn't get to the UK. I know. That was our clinic. We had over 100 patients, and we got shot down. I really wish, I wanted to see you so bad in person, and I was going to come and sneak in yours and your husband's dance studio and get in a little ballroom dancing.
I want to do that.
I used to do that. I loved it.
Really?
Yeah.
You should. I was thinking of doing like a fundraising dance class.
Or, yeah, I mean, one of our
cool.
doctors, practice manager, you'll meet him, Dr. 𝗧cie_𝗶𝗰.
Yeah.
So Steve Lopez is his practice manager, and he's a professional dance instructor, and him and his son compete in like salsa.
Oh,
so
fun.
we could do that. I've been saying to him we have to do something.
Yeah, I've been wanting to do a salsa class. It'd be really fun.
So Andrina, regarding the lasers, reduce overgrowth on ears. It depends. Now, we have the ND-YAG laser and some combo lasers that can get it down about 1 millimeter or more. And if you lay a dime on the table on its side like this, that thickness down there, that's about 1 mil of a dime on its side. If it's more than that, you have to have repeated treatments, but there are some doctors that can get some tissue reduction, but only a few that I know of that are that skilled. Dr. Goldberg in Arizona is #1 in the world with getting tissue that could be out here down, 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 and down. But you got to find the right doctor. If you email me, I can always tell you who you could see, because I don't know where you're from. Again, that's, depending on where you are. Hi, Samantha. Make sure you let us know where you're from. Pressure fluctuates. Yes, it does. It can be tricky. That's why, I don't know if they have them. Do they have at-home? I wonder if they have an at-home glaucoma check like they have for so many other things now, where you puff it in your eye like a breathalyzer,
I don't know.
Puff it in your eye. Maybe I should invent that
There
and
you
raise
go.
money
There you go.
for VBF.
There's got to eventually be a Linda, medical device of some sort, yeah.
Hello, Alessandra. Hi, Donna. Hi, here's Kay Elizabeth. Hello. We're taking any questions you want on awareness, any questions you have for Paige.
That's
I'm
really
so
sweet,
excited that you all have, if you haven't been to Sephora, you have to go.
Yeah, or Ulta.
And get a picture, and then you have to send it to her, because we need to make a big collage.
I've been collecting. And with you in it.
Yes,
preferably.
with you,
Yes.
whoever you are.
Yeah.
Guy, girl, child, adult, 81 or 1 month, whatever.
Yeah.
With your birthmark with it, and send it in.
It's been really fun getting actually literally that range. People with their babies and just people that are in the later part of their lives and taking photos and being super excited. Yeah. It's definitely a moment.
Allie. Oh, Allie's on. Hi from South Carolina. You all have been a blessing for our family, moving in the right direction, treating the CM and PGs. Yes.
Oh.
We've been communicating recently. Hi, Elizabeth. Hi, Lena. So I guess another question that I would have for you. So you've broken through this barrier, and actually you're birthmark is now your signature. Where before you were covering it, now it has become your signature, which I call that making lemonade out of what could have been conceived as a lemon, right? Or making you find your purpose through your own birthmark. Now, and you always have a positive spin on it, but as we've talked, there are people that don't like their birthmark. Yeah. But at least they have us as a community, right? And so even if you don't celebrate it, and it has been a nightmare, as it has been for some people, our community is all inclusive. Whether you hate it, you love it, or you're indifferent. I will say, no one causes these. If a human being could cause a vascular birthmark, then we'd have the cure, because then we'd know what you did that made it happen. We know smoking causes lung cancer, okay? But it's a mutation. We can't even replicate an infantile hemangioma. No one's been able to even grow one in a lab because they don't know what it is. They don't know how to make it happen. So that just shows you there's nothing. I'm the mother of a child with infantile hemangioma. Your mom was the mother of a little girl with a port wine stain. She didn't do anything. I didn't do anything. You didn't do anything wrong. So dads or moms.
Definitely.
So whatever anybody says, there's nothing you can do to make it happen.
Definitely. And I, obviously with my page, it's annoyingly, repeatedly of just embrace yourself, just who you are, be authentically you, to stand out. Obviously I do a lot of highlighting and very understand that that's not where everyone is at. So and I hope that like doesn't come across to ever feel guilty if you're in a place of not loving your birthmark yet, or just in general, if you don't feel comfortable highlighting your birthmark. I'm very, very understanding of that too. Everyone, we're all on our own journey, and it's as long as we're just happy, that's all that matters. If that means covering it up, but you have an acceptance for yourself, and if you're doing it for a happy reason, just know that your worth does not shrink based on the world not seeing it yet.
And I always make this correlation because 100 years ago, cleft palates weren't being operated on. Now, when the baby is born with a cleft palate, and they actually had legislation, and it's 20-some states right now, they're mandatorily put into a program for getting the cleft, the surgery, the tongue, the teeth, all of that taken care of. That took decades to get that to change, to where now you almost never see a baby 1 or 2 or 3 years old with a cleft palate because they've gotten that early intervention, early involvement. And most of those people would never choose to live with it because it affects speech,
breathing,
and medical things, where 30% of all port wine stains are nothing. They're not going to thicken, they're not going to change, they're not going to do anything. Then celebrate it, or embrace it. How will you know? You'll know by 30 or 40 years old if you start getting little dots, we call them blebs, or if you see it thicken, or if you can close your eyes and put your hand over your birthmark and feel a difference in the texture of the skin. You can feel the border where it ends. That means even if it doesn't look it, but it is thickening. So you have to close your eyes and run your hand over it, and if you can feel that rim or a line, that's the thickening. And that's when you want to get it treated to keep it healthy. Now you can choose not to and live with the overgrowth. Some people just don't want to. We have a wonderful photographer that's with VBF. She travels around with us, and she has a lot of overgrowth, and I've had doctors offer, let me do this, let me do that. And she goes, nope, I'm 50-some years old, I've lived with it, and this is what I want. And that's her choice. And people have choices. Just like they have choices to say something nice or something not nice, they have choices to choose to get treatment or not get treatment, or to live with it, or to not want to live with it. And I think this whole, unfortunately, this movement away from the great progress we've made in the last 10 years with inclusivity, thank God what's going on now didn't happen 10 years ago, because we've picked up so much momentum. I mean, I see little babies in outfits and ads with birthmarks, and I'm so excited. You wouldn't have seen that 10, 15 years ago. You wouldn't have seen a baby with a birthmark and for little outfits and Toys R Us and stuff like that. every time I see it, I want to cry because I'm so happy, not sad. I'm happy.
And now we have dolls that look like us.
Yes,
With
and
the 𝗧cie shop,
yes,
VBF.
yes, that's right. Why don't you talk about that a little, the 𝗧cie shop doll,
man.
because you got one.
Those dolls are so cute. I wish I had one on me. So with the 𝗧cie shop, VBF and 𝗧cie shop are doing a really beautiful partnership for how long? Like,
We started this year,
okay, so
or maybe in the
for,
fall.
hopefully for a while, but you can get your own customized doll. It's like a plush-like doll. They've got a really great range of kind of styles, but then you send in a photo of your difference, and they customize it, which is really, really amazing. So for the very first time in my life, I've got a doll that looks like me, which is really, really incredible. I mean, I don't want to give my age away, but I'm just saying, like, it is healing some childhood desires for sure. Because, you know, I wanted to connect with dolls when I was younger, and I really wanted to connect with Barbie and stuff, but I played with stuffed animals instead, and the closest I got to Barbie dolls were like the Barbie animals. I had like a Barbie farm. I wasn't even into like the dolls because I couldn't relate with any of them. The closest I could get was like their Dalmatian dog. You know?
I had somebody years ago say to me, why don't you reach out to Mattel and ask them to make a Barbie with a birthmark?
Oh,
And
my God.
I did that like 10 years ago. They weren't ready, but maybe now.
I mean,
maybe now.
their diverse line. I think they've definitely done some work within the last decade, and now they're really claiming to be the most diverse doll in the world. So let's see if that really
I like that.
sticks. Because the next doll, like, I don't know what it would be besides a facial difference. So we're working on it.
Yeah, I
might have
love
some
that.
news, too.
Alessandro saying, just sharing thanks to VBF conference and clinics. My girl started treatment with Dr. G back in 2015. She was less than 1 year old. Now we're on maintenance with Dr. Bernstein. He's amazing. That was Dr. G's partner. Keeping it healthy. Yes. She is a confident girl who educates everyone. She needs to be a VBF global ambassador.
This younger
Alessandra.
generation is gonna like blow us out of the water.
Yeah, Kiana, you reach out to Alessandra 𝗧cie𝗶𝗰 because her child there, 15-year-old daughter, needs to be a VBF global ambassador because she's already educating people. I love it. See how
Awesome.
you as parents of children with vascular birthmarks can educate, and then the child can educate. And we've even had fathers who have had birthmarks come to me and say, my kid's getting comments about my birthmark, and then
Right.
how that they can educate. And we forget about that.
Yeah.
You know, we forget that the parent who has a birthmark and has children, that maybe their children wonder why, or their children's friends have something to say. And again, that's what the month of awareness is about. If everybody becomes aware of vascular birthmarks, and that it doesn't mean there's anything wrong with the person, they have.
It'll debunk those narratives.
Yeah, it's like a flower. They got something different, right? Birthmarks are like flowers. They have a birthmark.
Right. And people also don't have anything else to reference. Like they're not educated, right? We're not educated about this in school. In medical school, I'm still told that you have one 30-minute lecture to cover all 3,000 plus skin conditions. You know, which is makes a lot of sense as to why I'm educating a lot of doctors, especially who are not dermatologists, of what this is. And there's a lot of work to be done. And then the only representation that's the closest that we have tend to be villain characters, unfortunately. So yeah, if anyone's going to make a comment, they don't have anything else to reference besides Two-Face or Freddy Krueger, which is, you know, something that I'm called often.
Right, and I've heard that referenced a lot. I mean,
Yeah.
I get so angry when I hear that, but like we know, just
Yeah.
people are just, I don't know whether they wake up and say, I'm gonna be mean today, but people, like, there was that old show, Kids Say the Darndest Things, but this is people. People
It's
just say,
unhappy people saying the most unhappy things.
yeah, something like that, because I would never, well, of course, I walk up to people and say, hey, I'm Dr. Linda, I can help you. But I would never walk up to anybody with something and just say anything
Different, and
different,
that you didn't
and
understand,
just say it, you know.
Right.
I'm obsessed with medicine and medical things, so I want to learn.
Right.
You know, I just want to learn about it. And like
Right.
you said, with physician education, the reason I started the I team, the VBF I team, which is the top 15 experts in the world, travel to different countries to educate doctors, is for the very reason that it is not it cannot, because it's a rare disease, be included in a curriculum. We sent 500 books out to every medical school in the United States in 2005, asking them to integrate the chapters into their curriculums. So the battle was, well, does it go into derm, or does it go into the integumentary system, which always is covered by derm? Is it skin, or do we put it in pediatrics, but then that misses out on the adults that don't present with like an ABM or something until later. So
Can it not be in multiple?
well, not, it, you know, because of vascular birthmark affects head to toe, inside out, you're covering every system in every medical discipline, and no one wants ownership of it. The most awareness comes from the derms, because they laser.
Right.
But they don't treat AVMs, they don't treat lymphatics, they don't treat venous, they don't treat a lot of these conditions, so they don't have a hero.
Right.
They don't even, like, the interventional radiologists are the ones that do most of the treatment of venous, lymphatic, and AVMs, and that's a fraction of what they do, just a fraction. So it's very difficult. Another shocking thing, because you said like 30 minutes, there's only one class on nutrition in medical school. You know, the most important thing is what we put in our body. Right? The most important thing. And that is just that my master's was in nutrition, so this was a big thing for me, was the lack of nutritional education by doctors, which I believe has attributed to the obesity in our country and children, was because doctors just weren't educated, and they weren't talking to the parents. And you know, a plump baby was supposed to be beautiful and plentiful, and a plump woman was supposed to be beautiful and plentiful, but now we know it can lead to diabetes and all other problems. So it's just continuous knowledge. And when you go to medical school, because there are 10 disciplines, you have to learn about each one, and then you go into your residency and you specialize, but you only specialize on a very narrow field. Maybe it's surgery, or maybe it's facial surgery, or maybe you want to be oncology, or maybe you want to be a surgeon or radiologist, and it gets very narrow. So we're rare.
So what was the response when you were trying to get it into
We sent the 500 colleges, medical schools that we sent it to, only 2 responded back to us. That they would consider adding some of the content to an online accessible link. But we never found out if they did it, like extracurricular reading. And even today, like Dr. Darrow, who's our dentist, he's an ENT and a dentist both. He is the only expert in the entire country that understands what vascular anomalies do to gums and teeth, whether it's port wine or lymphatic or venous. He's the only one. So every year at our conference, because he's so determined to educate, we have the free dental clinic at NYU. He brings in 10 to 12 dental students and trains them through our free clinic. We have the free dental clinic so other medical students can learn. And this is when we have our conference in New York. We make it free for doctors to attend and learn. I mean, how much more? We had the VBF online course in vascular anomalies. It's free. It's on our website now for doctors. So if they want to go, and they do 16 modules, they're 30 minutes each, and each module has a Q&A at the end. Oh my Lord, it's almost 1 o'clock. I was just curious to see the time, but we're getting close to the finish line, people.
Well, I'll sidebar with you, because I'm very, very curious as to how we can kind of make that more of a reality, because I mean, that's just ridiculous. It's just ridiculous.
That's beautiful, 𝗧cie𝗶𝗰. She said, my newborn has a large hemangioma on her face. I was really scared of it, but thanks to this community, I've been able to come to terms with it. Thank you. That's very important. And
community is one of the most important.
And I hope we're getting proper treatment if the baby needs it, because you said it's pretty large hemangioma. I'm hoping it's diagnosed accurately. You can always private message me and let me see a picture. If it was fully present at birth, it's not an infantile hemangioma. Could be congenital, or one of our other ones. So the most important thing is to have the accurate diagnosis so you get the appropriate treatment. Well, Paige, it's 1 o'clock. I cannot
Yeah,
believe
I know.
it.
Time flies when
This
you're having fun.
went by so fast. It's just been a blessing. Jeff says a wonderful example of ideas and support. Thank you. I
Aw.
love that. Yep, the
Thank
Mattel thing. I
you.
love that.
Yeah.
I don't want anything to stop you from what you're doing because I feel like you're on this major mission.
Yeah.
You know, and it's not just for people with birthmarks. You're inclusive for any facial difference or any difference at all.
Any difference.
Visible differences.
Yeah, definitely.
And tell everybody about in October, I think Selena's doing
Yes.
another another paint or some activity.
Yeah, she's doing her gallery and another like sit down, like port wine and paint
Yeah.
At her gallery, I think at the same time. And that'll be that Saturday following the conference.
Right,
in
and
Billiot.
then Kiana, I've already talked to her, and she can reach out to Selena that VBF is, you know, more than happy to, you know, if they can have snacks or stuff like that, you know, do
Oh, I
something
love
to
that.
upscale it a little bit, or if they're allowed, you know, if there's anything we can do to support this and promote it.
Okay.
I love it as a wrap up
That's
to
amazing.
the
Yeah.
conference and clinic.
Totally.
So, October 10th and 11th is our super clinic and conference in October in New York. Paige will be there. She'll be doing her, I call it bedazzling, enhancing. She's done great. She does these with the kids and adults.
Yep.
And adults, they love it.
Yep.
You can continue to see her at Ulta and Sephora, so make sure you take those pictures and send them to her or to me. I'll get it to her, or Kiana will get it to her. Is there anything you would like to say in closing about our month of awareness or what people can do?
Yeah, absolutely. I mean, yeah, we still got the whole month. We got a few more weeks, a month of awareness. You can, obviously, there's a lot of ambassadors that have been sharing their stories. So if you don't feel comfortable sharing your own story, which is a great educational awareness type of post, feel free to like, comment, and share some of VBF's comments and posts. You can also join my birthmark highlight challenge, which I'll still be taking videos for probably another week and posting it more towards the end of the month. There's more information on my Instagram page. And yeah, also throw a fundraiser for VBF. You know, it makes Instagram, Facebook make it really easy. You can kind of just link it right on your bio. Even $50, $100, it helps. It helps us so much to keep continuing to support the medical resources and, you know, community-based events, which again is incredibly important.
Yeah, I was going to say, and remember, we're the only charity in the world, and VBF is #1 in the world for general vascular birthmark information, and I call them VBARs, vascular birthmarks, anomalies, and related syndromes. But in October, we have free laser, free dental, free glaucoma check, free ultrasound, free psychotherapy, the bedazzling, book reading for children, consultations with 15, 16 doctors. You can find this all on our website at birthmark.org. So thank you very much.
Thank
and
you.
Stay healthy and stay well, everyone.
Yep.
And remember, it's still May as our month of awareness, and you can still put on your birthmark.
Yep, because it is art.